Good afternoon, everyone. Thank you so much for joining us, and thank you for being patient as we prepare to start our Post-Bacc Premedical Program webinar today. My name is Nicola Willie-Fenton. I'll introduce our panelists in just a minute as we talk about our Post-Bacc Premedical Program. As I've mentioned in the chat box, if you have questions, please put them there. I will be monitoring those questions and trying to capture them as often as possible. We'll take pauses throughout the presentation to get to your questions and always have an opportunity to have those questions at the end as well. So we have a full agenda, and we're going to try to keep this to a half hour because I know your time is precious. And so we're going to go through quick introductions. We'll talk about UVM's Post-Bacc Premedical Program, what that is, what are the benefits, and really one of the things that we're talking, especially with our guests today, about building that strong candidacy for whatever is next for you, whether it's dental school or veterinarian school or medical school. How does UVM's program help you to build the strongest candidacy possible? We're really going to dive into some of those outside the classroom learning opportunities, and we're going to hear from Laurie with AHEC here at UVM as well. And we always love to hear the students' perspective. We have a wonderful video today with one of our former post-bac students who is in the process of receiving her acceptance letters at various different medical schools. So we'll hear from her as to how well she felt prepared for those applications and those interviews as she continues to pursue her dream of becoming a doctor. And then we'll also talk about some of those opportunities. Where do our students go? And we have lots of slides and a long list of schools that really are after UVM post-bac pre-medical students. And as I mentioned throughout, please share any questions and I'll try to capture those as we go along. So joining me today is Jennifer Lyon. Jen, thank you so much for being with me today.
Thanks for having me.
And Jennifer is really your connection with our post-bac program here. She works with you in the beginning to set a plan. She helps advise throughout the entire process and helps and really holds that hand and advises you as you move on to whatever is that next goal. And Jen has been advising students specifically in health as well for the past 15 years. And she's a huge asset to our students here. And we appreciate that your time and being here today as well. And we're so fortunate to have Laurie McLean with us as well. Laurie is the program coordinator for the Office of Primary Care and AHEC program at Larner College of Medicine. So really unique perspective for our post-bac students to see the opportunities that they get to have here at UVM thanks to the incredible programs that you have. Thank you for being with us, Laurie, today.
You're welcome. My pleasure.
And we're really looking forward to hearing about some of those programs. And Laurie even brought us props today. So unfortunately, you can't touch and feel them, but you'll get the idea of the things that you can do if you are participating in our program. So let's start a little bit higher level first before we dive into some of these details. What does it mean to be in our post-bac pre-medical program here at UVM? And I'm going to ask Jennifer to walk us through some of these different things, but really some of the highlights that people ask very often and people are searching for, as we know from prospective students, is access to not only the experience of the medical school, because they can immerse themselves in that environment, even studying in the library, being surrounded by medical students. So it's like you're constantly having a reminder of your vision and what you're trying to accomplish and why you're here, but access to a level 1 trauma center at the hospital. So these are things that are here, not only accessible to you, but the buildings are all connected. And so it's a really unique opportunity for our post-bac students to live and breathe what they're hoping to attain here. And so can you share with us some of the other things as to what are unique about UVM's program?
Sure, absolutely. I know that we've heard feedback countless times from students who say it's such a gift, like you were saying, to be close to the hospital here and to be able to, be done with a class and just walk 5 minutes and be at their position, their clinical research position, or whatever position, maybe volunteering in the hospital. And with that becomes the wealth of opportunities to network with health professionals, physicians, faculty from the College of Medicine, which is also a very big draw. Some of our classes are co-taught specifically with College of Medicine faculty. So a wonderful way to learn sort of and make relationships with people who will be critical to their future, especially when many students like to try to attend Larner, UVM Larner. We also have MCAT preparation. We have a partnership with Kaplan. We do a specific, it's called a committee letter for applications to medical and dental school. And we know that medical schools across the country really like to read a committee letter on behalf of a student where everything is rolled into one letter and they can read that and move through their process quicker.
Mhm.
As Nicole said, I work really hard with students. We do an assessment when they come in terms of where they are around their science math GPA, where they're feeling maybe some areas of growth and opportunity or focus, and we work on that. And outside the classroom learning, we talk specifically about research opportunities, patient care service, and shadowing. We'll probably talk a little bit more about
Yeah, we'll get a lot more in depth into some of
Yeah.
those outside the classroom opportunities. And I think one of the things that you're not probably giving enough credit to is that personalized advising and support and the flexibility of this program.
Right,
I
that's
hear
true.
time and time again from our students. And Anna Seaman, who's one of our graduating students, will reference this in her video. She would say, well, what if I want to take a higher level course? Or what if I
Right.
already have? And I remember Zach,
Right,
one of
right,
our
right.
students, said, well, I already had that.
Yeah.
Why do I need to take that again? And some courses are very rigid in terms of this is what we have and this is what you're going to do. Our program is flexible to what you
That's right.
need, but also at the same time building what we want you to get to be able
Right.
to move on to the next step.
Right. I really appreciate you bringing that up again, and that's something we do right in the beginning with students who are coming in. We do an assessment of the transcript, where they feel they might want to redo something if time has passed, a large amount of time has passed since they're coming back into that science curriculum, or they might not, and they might then move on to the higher level science as a way to distinguish their candidacy. Every single student here has a personalized learning plan,
Yep.
both in and outside of the classroom. So.
And that's really important. And I think that's been a big draw for some of our students as well. So, excuse me, there's also a variety of different tracks that you can choose. And so,
Right.
the majority of folks that do come to our Post-Bacc Premedical program are intending on pursuing a career in a medicine career and in pursuing an MD. But there's a variety of different folks and
Right.
so we really are trying to serve the various different needs and interests of our student population.
Yeah, and I'm glad you mentioned that too, because just recently I was getting ready with a student to start in the summer in May, and this student is on the fence a little bit, knows they want to go toward either physician's assistant or doctor of nurse practitioner. So the way we mapped the plan was to at least start the first 2 terms with coursework that we know is required and recommended for those 2 programs. Yeah, and often that's the case. And then maybe by the second term, they know a little bit more with all the opportunities that they take advantage of to shadow and get exposure. And through many of Laurie's programs, they're able to really see what they're most aligned with and what they feel most comfortable with.
Great.
Yeah.
And as I mentioned, please, if you have any questions, I'm trying to keep an eye on that chat box and we'd love to hear those questions. And so that's a great segue into Laurie. Thank you so much for being with us today. And so why don't you walk us through what is AHEC? So give us a higher level view about what is this wonderful organization.
So AHEC stands for Area Health Education Centers. It's a national organization, so almost every state has an AHEC. They're associated with universities and mostly medical schools as well. So here we're associated with the Larner College of Medicine through UVM. And we're the Office of Primary Care, and so we focus on primary care. Our purpose or our goal is to increase the healthcare workforce in the state of Vermont, especially in primary care. So when I say healthcare workforce, I don't mean just MDs, nurses. I mean everything. Social work, psych, anything. And so we do this program called our pre-health clinics so that we can sort of plant a seed with the students and let them know about different healthcare careers, give them a little bit of hands-on experience, play with some of these props, and learn something as well. It's amazing to see the groups that we get. We get huge attendance at these, and I've become very friendly with your Post-Bacc students because they come to every program that I offer, which is wonderful. The focus that they have is phenomenal. So it's really fun. We have.
Yeah, give us some examples of some things that you do that,
Mhm.
especially that our postbaccs are really drawn to.
I am. So we have coming up tomorrow night. We have an airways clinic. So we will learn about intubation as well as have training in naloxone, um, which is unfortunately necessary. We Some of the other ones we've had this year: vital signs and patient assessment, stop the bleed, uh, medical injection and IV access. Let's see, mental health and first aid is coming up. That's an all-day clinic that's going to be offered here at the college. Um, and we're even giving them lunch. They're very excited about that. We've had CPR clinics offered and a very, very popular suture clinic. And I did bring the a suture pad today. They get to look at all of these fake wounds on here and learn how to suture. And so it's all hands-on. And it feels like real skin. So that's really fun.
What is the value, do you think, that a postbac, and I bet, Jen, I would love to hear from both your perspectives. From your perspective, what is the value that postbac student gets out of this opportunity?
First off, we do our clinics in conjunction with the U.S. Army Medical Recruiters, as well as the Army Guard recruiters. And so they're medics. They help teach the clinics. They're telling the students briefly about their financial programs that they have. It's very scary for students thinking about going into med school and the cost that they're going to have coming out. There are programs that are offered that can help you through med school. One through the Army, one that we have to offer from our office called Educational Loan Repayment Program. And it's geared for primary care, MDs, NPs, PAs. We have for nursing, we have dental, loan repayment programs. And so what it is if you go into that area, primary care especially, you can apply for our loan repayment program more than 1 year. So you can get money in your pocket.
So students learn about these different ways that they can pay, and then they get the actual hands-on experience.
Exactly. We want them to know about some of the resources that we have. Another resource I let them know about is our placement professional. We have a professional in our office that knows of all of the medical MD, PA, NP placements in the state, and it's a free service that she offers to work with students and residents and get them placed. We want them to stay here.
And really the point too, I think that we're hoping that resonates with our folks listening today is this is outside of your classroom work. And so we've seen time and time again our postbaccs seek out and take advantage of these kinds of opportunities. And I'm going to move over to this other slide that I put up here that Laurie's programs is one component of the out of the classroom opportunities that you have here at UVM as a postbacc. And so you can see on this slide the variety of other things that you have available to you. And so will you share with us too what you think is that the value of having this robust opportunity here for our students to take part in?
Yeah, absolutely. I think, well, just to touch on the point I already made, it allows you and future health professionals to really get a better very real understanding, certainly the hands-on of the clinics, but also of with the exposure of ground rounds and all the outside the classroom learning. The monthly doc talks are very wonderful. And what it allows students to do is really understand what it is that health professional does and understand if they're very much aligned with that, or if they're, to learn more about knowing what they don't necessarily know in an outside the classroom learning environment. It allows you networking, and I hear over and over the value of the actual hands-on clinics to help the students really connect that theory to practice in many ways. So the classroom learning, science, everything there, but then they get to come in and do the hands-on. And additionally, I think, we talk a lot, and right now I'm in the, for medical and dental students right now, and these are valuable for all of our students,
Right.
whatever track attend all of these things you're seeing on the screen as much as their schedule permits. I think most valuable in many cases is the chance to just have that exposure, understand, like I said before, where they can tap into these
Right.
things to broaden out their candidacy. Right now, we're going through medical and dental application cycle, and in that is the committee review process. And part of that is very much academic, and very much related to the MCAT academics and other very necessary things that you need to apply to medical or dental school. Also, students and candidates need to really articulate how they've had exposure in the forms of clinical research, shadowing, volunteering, and patient care experience. And all of them have done all of that before they apply. It's very important. So having these opportunities are a very important part of their candidacy, and then the success later in becoming admitted.
And one thing that Jennifer has talked about a couple times is that this conversation happens early as you come into our program is where do you need this extra volunteerism or shadowing or you are thinking about MD, and so I highly recommend that you attend all of these different clinics. And how do you take advantage of filling some of those gaps so that when you are in that review process, your candidacy is really well rounded.
Right, and it really reflects all that you have taken advantage of and learned here, both here on campus through outside the classroom learning opportunities, and it connects the dots, and it enables them to roll everything up into a wonderful application.
And one of the things that I think is probably true is our post-bacs are in these clinics with medical students as well. And so again, it's that wonderful connection that you're talking and side by side and sometimes maybe partnering up with somebody that is a little bit ahead of you. And so there's that aspiration that I feel like that you can make that connection.
You're absolutely right. The other event I wanted to let you know about is the Vermont Recruitment and Networking Day, which Jennifer attended.
You've told me about that.
We have that in the fall. So I think this year is September 25th. It's something where we invite all of the Vermont hospitals and some other agencies in Vermont to come to UVM, Larner College of Medicine, for a day. It's sort of like a business fair. We understand that these students are not ready for recruiting yet, but it is your chance to network with the hospitals, just find out from them what they're looking for right now, what they might be looking for in the future. It may make a decision for you as to, wow, I talked to 3 hospitals that are looking for surgeons in the next 10 years. Maybe I really need to think about that, or of course primary care.
Right.
So it is a great networking opportunity, and they will be amongst med students, nursing students, residents. They love to talk to the hospitals, and the hospitals like to talk to them.
Yeah, absolutely. We've heard time and time again of some of our post-bac students who will go to some of these clinics or these talks and bring their resume, and then they walk out of there with a contact for a research position. And so these really are opportunities to learn a skill, broaden your kind of knowledge on particular topics in health, but also make really great connections to continue to build that candidacy. We do have a question here that I wanted to get to. Zipping down, hang on one second. Here we go. Aaron asks, is this program offered once we obtain acceptance, and how would we go about applying for the program you're talking about? So maybe you can clarify which program. Are you talking about the clinics or the loan repayment program? So Aaron, if you want to just share with me which program you're talking about, that would be super helpful. And these opportunities are available to post-bacs.
Right.
And so if you are a post-bac at UVM, start signing up, right? These programs.
I would just like to, we have students that I'm on the phone with or online with prior to even coming. So they're already talking to me maybe the spring before the summer or fall that they're going to start. and then they see, we add them to our listserv and they see an upcoming clinic, and some of them are local, or they become local very quickly, and they're able to plug
They
in
come.
even as prospective students. It's been wonderful to be able to have that. So I just think it's amazing. So it's
So
great.
as far as my
opportunity.
programs, as soon as I send out the notice of an upcoming clinic, Jennifer's one of the first people who get it. So you will be the first to know. Pretty
Yeah.
much, Jennifer's very good about blasting that notice out, and I get RSVPs right off, and it's
Good.
usually post-bac students first.
Right.
They know
Well,
the value. Right.
Yeah, and they're excited. They're excited to be
Mhm.
involved and to do that, and it's just such a wonderful opportunity for them to really plug in. On the flip side, if we talk about that, the
loan repayment.
the
Yeah.
consortium
Okay,
fair
yeah.
you had
Mhm.
mentioned earlier, I have talked to some of the booth participants there from various organizations who have commented as well, both on UVM undergrad pre-health and your students, Laurie, and also the post-bacs, and how much they value the work. In the past, many of these organizations that have been there have worked with post-bac
Yeah.
students in the form of clinical research or shadowing, or maybe a pipeline internship program. So it's a win-win all around.
Yeah.
And I would say, to echo Nicole, back to Erica's question, as soon as you're on board,
Right.
you're
Yeah.
able to take advantage of any of these outside
Yeah.
the classroom learning opportunities.
And if you're local, if you're here in Vermont already, then, let
Yeah.
Jen know, and she will share with you those opportunities. And I'm seeing Erin's really interested too about all of the programs we're talking about. So why don't you also, Kelly can put up our email address as well. And why don't you just reach out to us and let us know, follow-up questions to the post-bac, and then we'll direct that over to Jen. We can direct it over to Laurie so that we can share more specific information about some of the programs that we've been talking about today. I do want to get back to a couple other questions, and then we're going to hear from one of our students. Nate says, do post-bacs have same access to college resources such as libraries that undergrads have?
Yes.
Yes.
Yes. So post-bacs not only have resources and access to the data, to the library for undergrads, but I also very much encourage them to go utilize the Dana Medical Library at the College of Medicine. So that, we have everything, fitness center, everything
Yes, you have
is
access to
here
all
for
of
you.
the wonderful resources here.
Yeah.
And Caitlin
Keep
says,
going.
if we are trying to decide between a summer and fall start, should we apply for both? Or would it be okay to apply for summer start and delay if we decided to start in the fall? I think you see a lot of.
That's a great question. We absolutely, yes, apply whenever you'd like. And that way it gives you the peace of mind knowing that you're admitted and you can move forward then when you decide is right for you. We do allow students to, and often they take advantage of, deferring up to at least a year if they need to. And that is perfectly fine.
Great. Awesome questions. Thank you so much, everybody. So let's hear from one of our students. Anna, she actually just changed her last name. It's now Anna Rose, but you'll see it's still Seaman here in this video. But Anna is, she just finished up this past fall or this past May, and she is in the process of applying, and she's now gaining acceptance letters as well. So we're really excited to see where I don't know if she's made a final decision yet, but luckily she has some different options, which is usually the case with our post-bacs. So because of what we've been talking about today, the ability to build such a strong candidacy really affords you the opportunity, hopefully at many different schools, and then you can choose the right fit for you. So we're going to pause just a moment. We're going to turn off the mics and let you hear this video and hear from one of our students in their own words.
Because of the way that UVM is organized, with the campus and the medical center and the hospital all in the same place, it really sets you up to be so integrated right into the medical school, right into the hospital. I worked as a scribe during my time in the post-bac, so I met medical students, I met emergency medicine physicians, I met other physicians too, because the emergency department interacts with everybody pretty much. I saw how sort of customizable the program is. A lot of programs want you to take a set number of classes in a set schedule, and I was like, well, what if I want to add some higher level courses? What if I want to make my own timeline? So that was what really attracted me to UVM most. But I was so glad that UVM was my first interview because I felt so comfortable here. I know people. I know that it is truly such a supportive environment.
Hopefully that gives you a little bit of perspective as to how well our students feel that this prepares them. And I had spoken to Anna in the evening, and she had had her first interview that day. And so it was very fresh, and to see what she felt and how well she felt prepared for that. So, so when we talk about medical schools want UVM students, you can see a pretty robust list here, looking at folks that are looking for MDs, and really what Jennifer was talking about in terms of the different tracks that we have available to you. And sometimes you may change your mind. And that's also the flexibility of this program, because I suspect other programs, perhaps would encourage you to stay where you're intending. And so maybe talk about that, how you would go about doing that. If you come in with one idea and then you've migrated towards another, how does that work?
Well, the way that works is we go back and the student and I together, we will revise their academic program plan. We are working together to build a school list for, the institutions to which they plan to apply, learning as much as we can about them, and of course, paying special attention to the prerequisites, any ins and outs that are needed, like MCATs or DATs or, the PCAT or whatever their track is. And then we just realign, we readjust, and often it's this wonderful sense of I'm on the right track, and I wouldn't have known that unless I had come here and experienced this. So now I feel really good about it, and then they move forward. Just able to have that encouragement and support and flexibility to understand that it's okay. To, for example, doc talks that we have, we often will mix that up. We might have a naturopath. I think tonight we have a surgeon coming. This is for the doc talks, are after hours in the evening. Very nice informal sessions where students sit and talk to, tonight it's a surgeon. And so it could be, there's been nurse practitioners, there's been physical therapists, there's been neurologists, all kinds of specialties come in to talk. So having that exposure, understanding more about what you didn't know before, opens eyes, helps open pathways, and certainly shadowing opportunities to really solidify and affirm that now the student's on the right track.
And generally will help you decide what path is right for you. And I'll get to Ashley's question in just a second. I just want to touch, and I want to be mindful of time. We're going to try to wrap up in a few minutes, but I wanted to just touch base on some of these questions that you get asked most often. And I know that you get asked many, many times, how long is this going to take? So what are maybe just go through a few of these different questions here so that we can touch on those briefly.
Sure. So how long? So the academic portion typically takes between 12 to 18 months. And that can vary depending on what a student's coming in with, whether they want to repeat, etc. I think the cost is over in the box on the right. And of course, there's in and out of state tuition. We have a variety of different scholarships, summer, fall, and spring, available to students starting any of those cycles.
A cohort, you get that a lot too.
We do get it. And so it is funny, while you're not, so again, the cohort would be tailored to the courses that you're taking. So if you're deciding, like, perhaps you come in with nothing from your undergrad, you might be more in a cohort, right? But typically you're in a mix of maybe some undergrads and mixed in and also some post-baccs, maybe some PhD students and other. So you get the exposure, you get the opportunity to learn from other students.
And I think post-baccs find each other.
And they find each other
almost immediately.
They joke around and say, okay, I just go down, I look who's sitting in the front, and then I see the post-baccs.
And we also have a really wonderful opportunity in the fall, is the reception in the beginning of the school year. And so it's an opportunity for folks to say hello to people that they've met along the way, to introduce and feel part of the Post-Bacc family too. So I think that's a really great thing.
Yeah,
You can
and
somewhat, if you don't have as many people in your classes, you start to build that network of your cohort in your Post-Bacc
right,
program.
and then I bet you Lori sees this too, and then you see them all, where you see
Yep,
them
in the
too is in the
clinics and-
outside
yeah.
the classroom.
Yes.
They all
stuff,
sit
like
together, they
literally.
come in together, they're very friends.
Yeah.
Very
Right.
much friends.
Right,
Great.
right.
Yeah. And so there's a lot of camaraderie
Right.
with our postbaccs, and I've seen that quite a bit. We've talked a lot about research
Yeah.
and volunteer and shadowing and
Oh,
patient
that's
opportunities. And that is sometimes, there are ample opportunities for that here. And you've commented to me before that you'll identify that a student might need some shadowing or some patient care. And by the time you follow up with them a week later, they have a position at the hospital.
Yeah.
And so there are plenty of opportunities. It's a matter of working with Jen and identifying what those might be. So let's just touch base on a couple of these quick questions here. Ashley says, does the linkage program with Larner allow you to skip the glide year, or do you go through the traditional application process following the completion of your post-bac?
The linkage affords you the opportunity for a guaranteed interview if you meet the criteria. And it does not, and I'm not aware of any really
Time restraint,
opportunities
yeah.
around skipping the glide year. Everybody, because the med school takes so long, and they put, it's a lot of intention and care and consideration when they're making up their incoming class. And because that takes so long, it often is a
Ends
cycle,
up being a year.
like we,
Yeah.
yeah,
Yeah,
like we
right.
hear from
The
our
timing.
students. Yeah.
And then we have a question. What's the minimum GPA for consideration to the post-bac program?
We look at everything. I think we prefer students who are above a 3.0 minimally. I think that is not to say we haven't seen a little bit lower cum GPAs apply. Often there's a wealth of students have done all kinds of things. We have had, it's a real career changer.
Yes.
So we have had students who are nurses become doctors. We've had nurses become PAs become physicians, all sorts of things like that. And
Attorneys
so,
come into our program. I mean, just paralegals. We've had people from
Private
humanities
investigator.
backgrounds, I mean,
and then others like commercial fishermen. I'm like remember we have a few, and we have a large also group who come seemingly from the Marines, the Navy
Army,
SEALs,
Navy.
and other military
Yeah.
backgrounds.
And there's
So,
a great office here that works with our veterans as well. So there's a lot of support there too. And so
yeah.
there's just, and I think hopefully you're getting from our discussion today is that there's a lot of support for our students. There are ample opportunities to grow your strongest candidacy possible for whatever is that next step for you. And a lot of the support is sitting at this table today, is just how do you gain the experience, the hands-on experience of the different programs? How do you become aware of the financial resources available to you? And then how do you build your plan? And how do you have that support throughout your process here? And so that's really what we're trying to hopefully communicate today. Nate asks a good question, and I think we get this as well, the success rate of our students applying. And I believe it's upwards of 80%, if not higher.
Right, and if we're talking about medicine, because we do have other tracks, and medicine we're at approximately 80%. I think, I mean, it's interesting to see the data every year. It shifts slightly. I think we're doing very well with our PA students, and our dental students are probably 100%. I feel like.
Yeah.
So everybody's, I feel, very successful, and if they sometimes, like we said before, the advising goes in a way that, you know, and I think we had a slide talking about other programs. It might be a PhD. It might be they found their way in a lab directorship somewhere. It could be an anesthesiology assistant program, any number of things. Like you said earlier on, there's so many things in medicine that we don't even know about. So this exposure really helps.
Yeah.
One other quick thing I wanted to mention
please.
that you had said us at the table, and I want to give credit to our faculty in this program. We have faculty who will sit and after hours and work through chemistry problems with students. We have faculty who will write letters of recommendation, who will support you, want to know that you are doing well and how things are doing. They want to get to know you too. So I really want to give credit to the faculty here and all that
they want to see you
do.
succeed. They really do. I think
for
that's
our
one of the things
students.
that we've seen
Yeah.
too. You got to put the work in, but they really are here to support and to help our postbaccs go through that process. We have a great question from Stephen that says, how many experience hours do we need to apply in terms of shadowing, research, and volunteering?
Applying to
To the program. I don't think
to
there's a
Post-Bacc?
yeah.
we have students who come in as former paramedics. We have students come in with nothing.
Nothing. So it
I
really
have
just
art
depends.
majors
Yep.
and I have
Mhm.
bio majors. You know, it
Yeah.
really depends, and that's the whole assessment we do early on
Mhm.
and mapping where you want to be when
Mhm.
you apply to the
Yep.
health professional.
And we'll help you to get what you need, and through a lot of the opportunities that Lori's been talking about today. So I do have one last question. It looks like two. Are students able to work during the program? And I think that varies. The answer is yes, but it
It
really
depends,
depends on
yeah.
what your situation is personally. I've seen students and talked to students that say, I'm not going to work. I'm dedicating this time to complete this.
Right.
And then other students say, I have to work.
Right.
And
Right.
so
And
I
so,
see both.
yeah.
Mhm.
And so the plan again is tailored that you might have. I know I have students who work full time in the hospital. They're taking one course at a time.
Mhm. Yep.
And it varies anywhere in between. So
Right.
yeah,
So everything will
absolutely.
go, it works. And so we'll
Mhm.
just work with you on that as well. And then Caitlin says, is there a way to connect with post-bac students online via social media prior to the start of the semester, or we just meet them in classes?
Oh, that's a great
Mhm.
idea, Caitlin. Thanks for letting
Yeah,
us think
we
about
will.
that.
Why don't you follow up with us? Shoot us an email and say, and if this is something that you're thinking or you've been accepted to UVM and you want to connect with some, I know several people in our program that are very social and would love to make that connection. I think the fall reception is the perfect opportunity to make those connections, and
Right.
then jump into the clinics and
That's
start
right.
meeting
That's
everybody,
right.
and you will quickly connect with them as
But
well.
we do have opportunities. We do have we have a group of core current and alum student ambassadors. So many of those students are indeed right now. In fact, one of our prospective students is coming to visit, and a current student is already emailing her, lining up. You know, she's going to be accompanying him to the chem lecture,
Great.
and he's going to bring her over. They're going to take a tour, come over,
Mhm.
have the meeting. So there's opportunities for that, and I'd love to explore more of that with
Yeah,
our ambassador
that
group.
sounds great too. Any last parting words? Anything else that folks, if they're interested, if they a must come to or a must do?
I get a question often, is this free?
Yes.
Yes, it is.
Yes. Didn't touch on that.
We-
There we
It
go.
it
Thank
is
you for
free.
reminding us of that.
We
Yes.
welcome you to come, and I would love to meet you. I love to have the opportunity to have you at our clinics, and also let me know when you come to our clinics that you're a post-bac student, and if you have ideas for clinics, we welcome
Yeah.
those as well.
Awesome.
Yeah.
Thank you, Laurie,
You're
for
welcome.
Thank you so
welcoming our
much.
post-bacs into
Mhm.
all of these different opportunities and giving them these amazing opportunities. And thank you for sharing that information with everybody
bet.
today. Thanks, Jen. It's always a
You're
pleasure
welcome.
to talk about post-bac. You do see a date up there, though. I will put a little pressure on everybody, hopefully listening today, that if you're thinking about starting in the summer, your application deadline here is March 1st. I'm also going to zip back to this other slide. If you are thinking of starting in the fall, then your application date is July 1st. And I know it might not feel like that today. We are in Vermont and it's a little chilly outside, but those dates do come quickly. And so if you have any questions, please follow up. Please let us know. Jennifer will respond and get back to you or point you in the right direction if we have other questions. And if you're considering, and even if you're considering the start date for fall, I would highly recommend that you apply as soon as possible because we are limited in the amount that we can take in our post-bac program, and we'd love to see you there. Thanks, ladies.
Great.
It's been a
Thank you.
pleasure. Thank you, everyone,
Thank
for joining
you.
us today. We look forward to seeing you in our post-bac program, hopefully in the summer or fall. Have a great afternoon.